Okay, so you know how sometimes something will just keep popping up on your radar?
Yeah.
And you're like, huh, maybe I should look into that.
Right.
Well, today on the deep dive, we're going to be taking a look at chiropractic
Oh, very cool.
because we keep seeing more and more research about the role of chiropractic care and how it's becoming more and more integrated with other types of medicine.
Yeah, I think a lot of people are curious about that these days.
And it seems like it's really having a positive impact on patients, so we thought it'd be a good idea to do a deep dive into it.
Exactly.
So we've got two really cool pieces of research to explore today.
Awesome.
One is a qualitative study from 2018 by Lisi and a bunch of other researchers.
I've seen this one.
Yeah, it's a great one. They took a really close look at how chiropractic services were integrated into 9 different private medical facilities.
And different ones. Wow.
Yeah, and these were spread out all across the U.S., so a good representative sample.
That's great.
And what makes this study so interesting is that they talked to everyone involved. I mean,
Yeah.
they didn't just interview the chiropractors. They talked to physicians, administrators, even patients.
Really?
Yeah, they wanted to get a full 360-degree view of how the integration was working from every perspective.
That's smart.
Now, the second study we're going to dig into is a clinical trial that was also published in 2018.
Okay.
This one is by Gertz and her team,
Uh-huh.
and this one focused on active duty U.S. service members who are dealing with low back pain.
Makes sense.
Right, low back pain is so common,
It really is.
especially in the military.
Yeah.
So they wanted to investigate whether adding chiropractic care to the usual medical treatment helped these service members.
Right.
And this is a comparative effectiveness trial.
Oh, okay. So they were really looking at how well it worked in a real-world setting.
Exactly. They weren't just in a controlled lab environment. They were out in 3 actual military medical centers.
Cool.
So the goal today is to kind of synthesize these 2 studies
Mm-hmm.
and see what key insights we can pull out.
I like.
We want to go beyond, just a surface level understanding of chiropractic care.
Right.
And really reveal why it's being embraced more and more by the medical community and what the benefits are.
Yeah, what's all the buzz about,
Exactly. So let's start with that first study, the one about private medical facilities.
Okay.
What really got these places interested in integrating chiropractic in the first place?
Well, it's interesting because it wasn't just one single thing.
Okay.
It was usually a few different factors all coming together.
Oh, interesting.
One of the biggest things, though, was that there was strong support from the leadership at these facilities.
Yeah, that makes sense. You need buy-in from the top.
Exactly. If the people making the decisions were open to it and saw the potential benefits, then things could really get moving.
Right, makes sense. What else were they seeing?
Well, there was also a growing awareness of all the research that supports chiropractic care.
Oh, so they weren't just jumping in blindly.
No, not at all. Many of them were familiar with the evidence that showed how effective it could be for certain conditions.
Okay, conditions. Like what specifically?
Like musculoskeletal problems, things like that.
Mhm.
And then sometimes it was also about personal relationships.
Oh, so?
Well, sometimes a physician or an administrator would have had a positive experience working with a chiropractor in the past,
Right.
and that personal connection really helped to open doors.
So a combination of good evidence, leadership support, and personal connections.
Yeah, that's a good summary.
And then once they actually decided, okay, let's integrate chiropractic,
Mm.
how did they do it practically speaking?
Well, what's really interesting is that they didn't usually go and build completely new departments or anything.
That makes sense.
Instead, they worked within the existing infrastructure.
Oh, wow.
Yeah, they would just integrate the chiropractic clinics right into what they already had.
So smart.
So they used the same HR department for hiring, same IT systems for patient records.
Makes it much easier.
Yeah, and then they would just find available space, and they would often have to expand later on as the demand grew.
So they were popular.
Yeah, they were.
Well, that's great.
Yeah, it was much smoother than trying to create something totally separate.
I bet.
And they used the same administrative support staff, too.
Oh, wow. So it was really just kind of woven into the existing system.
Exactly.
And were they picky about the chiropractors they hired?
Oh, yeah, absolutely.
Yes,
Okay, I mean, they didn't just take anyone with a license.
Right.
They really wanted to make sure that the chiropractors they brought in would be a good fit for the whole team.
I see.
So one of the most important things was that they used an evidence-based approach.
Okay, so they were looking at the latest research.
Exactly, making sure the treatments were based on solid science.
Good.
They also wanted someone with really strong interprofessional case management skills.
What does that mean?
Well, it means they could work well with other healthcare providers and coordinate care effectively.
Oh, okay, so they're not just off doing their own thing?
Right, they're part of a team.
Uh-huh.
And, of course, they had to be able to work well in a multidisciplinary team. and their values had to align with the organization's values.
Yeah, that makes sense. You want everyone on the same page.
Right, and in the study, there was this great quote from a physician.
Oh, what did he say?
He said, "In our interviewing process, who the chiropractor is and whether they fit the culture is as important as their training."
Wow, so it was really about finding the right person, not just the right skill set.
Exactly.
So how did the chiropractors actually work with the other medical professionals once they were hired?
Well, one common practice was co-location.
What's that?
So that means they would be physically located in the same clinics or hospitals as the medical doctors.
Oh, okay, so everyone's under the same roof.
Exactly.
Okay, yeah.
And that made it much easier for them to communicate and coordinate care, especially for patients who are dealing with multiple conditions.
Oh, right.
Yeah, so someone might have a musculoskeletal issue and then also have some other health problems.
Uh-huh.
And this way, the chiropractor could work with the other doctors to come up with a comprehensive treatment plan.
Makes a lot of sense.
Of course, anytime you introduce something new, there can be a little bit of resistance at first.
Right. I'm sure there were some growing pains.
Yeah, a little bit.
Mm-hmm.
But the study found that most of those initial hurdles were overcome through open communication and education.
Okay, so people just had to get used to the idea.
Yeah, and once they saw that the chiropractors were really knowledgeable and
Yeah.
that they were getting good results for the patients,
Uh-huh.
the resistance usually faded away.
I bet there was also some good old-fashioned relationship building going on, too.
Oh, for sure.
Like grabbing coffee together or something,
Yeah, getting to know each other.
humanizing it all.
Yeah, and one of the administrators in the study talked about how building trust was really key.
Mm-hmm.
And that once that trust was there, the referrals between doctors became a lot smoother.
Okay, so everyone was getting on board.
Yeah, it sounds like it.
So it wasn't just the administrators who were seeing the benefits.
Right.
What about the patients themselves and the other medical providers?
Well, what they found was that the perceived value of chiropractic services was really high across the board.
Okay, so everyone was happy.
Yeah, pretty much.
That's great.
The patients were reporting high levels of satisfaction,
Uh-huh.
and so were the medical doctors.
Really? Even the specialists?
Yeah, even specialists like neurologists and physiatrists.
Wow.
Even oncologists were on board.
That's amazing.
And the administrators were really happy too.
Okay, so everyone's winning.
Exactly.
So how did they measure whether the integration of chiropractic was actually successful?
Well, they looked at a few different things.
Okay, like what?
Obviously, patient outcomes were the most important thing.
Right. Did they get better?
Exactly. And they also looked at how satisfied the patients were with their care.
Uh-huh.
In fact, some of the facilities were reporting incredibly high satisfaction scores.
Really? Like record-breaking?
Yeah, they're called Gainey scores.
The Gainey scores. Okay.
And they were really high in some of these places.
Wow, that's impressive.
And they also looked at provider productivity to make sure things were running smoothly.
Okay.
And they even tracked whether there were any cost offsets.
Cost offsets, what does that mean?
It means, were they saving money by integrating chiropractic?
Oh, interesting. I wouldn't have thought of that.
Well, it depended on how they were getting paid for their services.
Okay.
But in some cases, particularly in what are called risk-based models,
Wow.
they actually found that they were saving money.
Wow. How so?
Well, one example they gave was that one facility saw about a 50% decrease in unnecessary hospital admissions for low back pain.
Seriously, a 50% reduction.
Yeah, it's pretty amazing.
Wow.
So basically, people were getting the care they needed from the chiropractor,
Right.
and they didn't have to go to the hospital as often.
Okay, that's huge, both in terms of cost savings and patient outcomes.
Exactly.
So less time in the hospital, less money spent, better outcomes all around.
Yeah, it's a win-win.
So what about the patient experience? I mean, what were people saying about going to a chiropractor in this type of setting?
Well, one interesting thing was that a lot of the patients had never even considered chiropractic before.
Really?
Yeah, but they were really impressed with the care they received.
I bet.
And they liked how seamlessly it fit in with the rest of their medical treatment.
Right, so it wasn't like they were going to this completely separate thing.
Exactly. It felt integrated and holistic.
Uh-huh.
And one patient said that she was really impressed by how thorough the chiropractor was
Okay.
and how well he was able to tie the treatment plan in with the rest of her medical care.
So she felt like he was really taking everything into account.
Yeah, exactly.
That's great.
It really highlights the importance of that collaborative approach.
It does.
So overall, this study really showed that chiropractic care can be successfully integrated into private medical facilities.
All right.
And it seems like the patients, the providers, and the administrators are all pretty happy with the results.
Yeah, it sounds like a really positive trend. What were some of the challenges they mentioned?
Well, one of the main things was navigating the whole billing and reimbursement system.
Oh, right. I bet that can be a nightmare.
Yeah, especially in those traditional fee-for-service models.
Uh-huh.
But as we talked about earlier, in those risk-based models where they're responsible for the total cost of care,
Right.
there was real potential for cost savings.
Okay, so maybe that's going to drive more integration in the future.
Could be.
And just to clarify for our listeners, what exactly were these chiropractors doing?
Well, they were providing a full range of diagnosis and management for lots of different musculoskeletal and neuromuscular conditions.
Okay.
So they were using manual therapies,
Okay.
therapeutic exercise,
Right.
and patient education.
So it's not just about cracking backs.
No, not at all.
Okay.
It's a much more comprehensive approach.
Okay, that makes sense.
All right, so now let's switch gears and talk about that clinical trial with the military personnel.
Okay, the one about low back pain.
Yeah, so as we said earlier, this was a pragmatic comparative effectiveness trial,
Right.
meaning it was designed to be as close to a real-world setting as possible.
Okay.
So they had these active duty service members at 3 different military medical centers,
Uh-huh.
and they split them into 2 groups.
Okay.
One group received usual medical care.
Okay, what did that include?
Well, it could include things like self-care advice, pain medications, physical therapy,
Right.
referrals to pain specialists, that kind of thing.
Okay.
And then the other group received the same usual medical care, plus they got chiropractic care for 6 weeks.
Got it. And what exactly did that chiropractic care involve?
So the main thing was spinal manipulative therapy,
Okay.
which is applied to the lower back and the areas around it.
Right.
But they also used other therapies like rehabilitative exercises,
Okay.
cryotherapy, which is cold therapy,
Right.
heat therapy, and other manual therapies.
So it was a whole package.
Yeah, it was a multimodal approach.
Right.
They really tailored the treatment plan to each person's individual needs.
Okay, that makes sense. And what were they looking at to see if there was a difference between the two groups?
So the 2 big things they were measuring were pain intensity and disability levels after 6 weeks of treatment.
Okay, makes sense.
Pain intensity was measured using a numerical rating scale.
Oh, so 0 to 10.
Exactly. And disability was measured using something called the Roland Morris Disability Questionnaire.
Okay.
That's a pretty standard questionnaire.
Uh-huh.
It looks at how much back pain interferes with your daily life.
Okay.
And then they also looked at some other things,
Like
like how much the patients felt they had improved overall,
Right.
how satisfied they were with their care,
Huh?
and how much pain medication they were using.
Okay, and they followed up at 6 weeks and 12 weeks.
Exactly. They wanted to see if the effects lasted.
Makes sense.
Yeah.
So what did they find after those first 6 weeks?
Well, the results were pretty clear.
Okay.
The group that got chiropractic care, along with their usual medical care, did significantly better.
Oh, really? How much better?
They had moderate improvements in both their pain intensity and their disability levels compared to the group that just got usual care.
Okay, so real tangible improvements.
Yeah. And not only that, but they also reported higher levels of satisfaction with their care.
Okay.
They felt like they had improved more overall,
Mm-hmm.
and they were taking less pain medication.
So less reliance on drugs.
Yeah, exactly.
That's great.
And all of these findings were statistically significant.
Okay, so it wasn't just chance.
Exactly.
What about at the 12-week mark? Did those improvements hold up?
Yeah, for the most part, the findings at 12 weeks were similar to what they saw at 6 weeks.
So the benefits lasted.
Yeah, which is really encouraging.
That's great.
It suggests that adding chiropractic care can have a long-term impact.
Right, not just a quick fix.
No, it seems to have lasting effects,
Yeah.
though the difference between the 2 groups was a little bit smaller at 12 weeks than it was at 6 weeks.
So maybe the effects start to wear off a bit over time.
It's possible, but they were still statistically significant.
Okay, good.
Now, they also did something called a responder analysis.
What's that?
So basically, they looked at the percentage of patients in each group who reported at least a 30% reduction in both their pain and disability.
Okay, so a clinically meaningful improvement.
Exactly. And what they found was that a significantly higher percentage of people in the chiropractic group hit that 30% mark.
Wow, so more people were experiencing a really noticeable improvement.
Yeah, it seems like adding chiropractic care really made a difference for a lot of these service members.
So how do these findings fit in with the existing recommendations for treating low back pain?
Well, the researchers pointed out that these results really support the idea that chiropractic care should be included as part of a multidisciplinary approach to managing low back pain.
Okay.
And this aligns with a lot of the current clinical practice guidelines, which
Right.
often recommend non-drug treatments like manual therapy as the first line of defense against low back pain.
So before they jump to medications or surgery,
Exactly.
so chiropractic could help people avoid those more invasive options.
Potentially, yes.
That's great.
Now, of course, we always want to make sure that any treatment we're talking about is safe.
Right, safety first.
And the good news here is that there were no serious adverse events reported in this study.
Okay, so it seems like the chiropractic care they used was pretty low risk.
Yeah, that's definitely a reassuring finding.
Now, remember we talked earlier about how the chiropractic care wasn't just spinal manipulation?
Right, it was a multimodal approach.
So it wasn't just cracking back?
Exactly. They were using a variety of techniques to address each person's specific needs.
Okay, so that's probably why they saw such good results.
Yeah, it's likely that the combination of approaches is what made the difference.
Makes sense. And because this was a pragmatic trial done in actual military medical centers, does that tell us anything about how applicable these findings might be to other healthcare settings?
Yeah, I think it does, because
Okay.
they designed the study to reflect real-world clinical practice.
Right.
The results are very relevant to that context. And they can also provide valuable insights for other healthcare systems that are considering integrating chiropractic.
So it's not just limited to the military.
Right.
Okay, that's good to know.
And one last thing that I thought was interesting about this study is that they had a pretty diverse group of participants.
Okay.
A lot of the older studies on spinal manipulation have focused mainly on white people.
Right.
But this study had a mix of races, ethnicities, and ages.
So the findings are more generalizable.
Exactly.
That's great.
It suggests that chiropractic care can be beneficial for a wide range of people with low back pain.
That's fantastic. Okay, so let's step back for a minute and think about what we've learned from these two deep dives.
Okay.
What are the key takeaways for our listeners?
Well, I think the main takeaway is that chiropractic care is gaining more and more recognition as a legitimate and effective treatment option.
Right.
The research is really starting to pile up, and it's being embraced by more and more healthcare providers and institutions.
And it seems like the patients are really happy with it, too.
Yeah, that's important.
So what does this mean for the future of chiropractic care?
Well, I think we're going to see it continue to become more integrated into mainstream medicine.
Okay.
And I think we're also going to see more research being done on its effectiveness for a wider range of conditions.
That would be great.
Yeah, there's still so much to learn.
Right. And it seems like chiropractors are really focused on evidence-based practice.
Yeah, that's one of the key things that's driving their acceptance.
Right. They're not just relying on tradition or anecdote.
Exactly. They're looking at the research,
Uh-huh.
and they're using the latest scientific knowledge to inform their treatments.
And they're also really good at collaborating with other healthcare professionals,
Yeah, they're team players.
which is so important.
Absolutely.
I think that's one of the things that's really changed the perception of chiropractic.
I agree.
It's not this separate alternative thing anymore.
Right. It's part of a holistic approach to health and well-being.
And that's really exciting.
It is.
So where do we go from here?
Well, I think the big question is how can we use this knowledge to improve the way we approach musculoskeletal health in the future?
Right. How can we make sure that people are getting the best possible care?
And how can we integrate chiropractic care in a way that makes sense for everyone?
Yeah, that's a great question.
It's going to be interesting to see how this field continues to evolve.
It is. We're living in exciting times.
I agree.
Well, this has been a really fascinating deep dive.
It has.
Thanks for joining us.
Thanks for having me.
And hopefully this has given our listeners a more informed and positive perspective on the benefits of chiropractic care.
I hope so.
It's definitely something to think about.
It is.
All right, we'll see you next time on The Deep Dive.
Sounds good.